Hello everybody, my name is Susie Shepherdson and I am going to be presenting on my poster, The Neural Correlates of Autobiographical Memory Retrieval, a Seed-Based D-Mapping Meta-Analysis. So I'm going to start with a brief overview, and then if you are interested, I will continue on with specifics. So basically, this is a meta-analysis identifying the neural correlates of autobiographical memory retrieval, and we used the SDM meta-analytic method. We used the largest set of studies to date, along with SDM, to create the most powerful meta-analysis to date. Basically, we found areas that were common to the AM network, such as the ACC and PCC, and other frontal, parietal, and temporal lobe activations, as well as areas that were less common, that had maybe been identified in one or two other meta-analyses, or had differing lateralizations across other meta-analyses, and this meta-analysis is able to clarify those and identify bilateral activation of these areas. And so it brings clarity to those inconsistencies. We also conducted two supplementary analyses, the first looking at two different types of autobiographical memory tasks, rehearsed versus spontaneous, and identified very few differences in neural activation across these two tasks. We also looked at three different types of control tasks and assessed the overlapping activation across these three different control tasks in order to identify the most commonly activated areas by AM retrieval. So now I'm going to go into more specifics on each section of my poster, so I hope you stick around. Okay, so starting over here with some introductory material. Autobiographical memory, which I will commonly refer to as AM, is a type of episodic memory that involves the recollection and re-experiencing of personal life events. Many neuroimaging studies, as well as meta-analyses, have been conducted in order to find areas that are most consistently activated during AM retrieval. This meta-analysis examines those neural correlates by using the largest set of AM studies to date, combined with a powerful meta-analytic method. And we also identified two supplementary analyses, first looking at the role of control tasks, and also whether the memories were rehearsed or spontaneous. Moving right along with some methods, we used a PubMed search and extensive inclusion and exclusion criteria to identify 54 final papers to include in the meta-analysis. We then used SDM as our meta-analytic technique, and all images are that are presented are thresholded using threshold-free cluster enhancement, FWE, and P less than 0.05. Okay, now getting into the results of the entire meta-analysis of all 54 papers. We found areas that were common to the AM network, such as the ACC and PCC, bilateral, medial temporal lobe, and other areas that are common to the AM network. We also found areas that were less common, areas that have maybe been identified by one or two other meta-analyses or had varying lateralization. And this meta-analysis was able to show bilateral activation of all of those areas, the LOC and middle temporal gyrus, inferior frontal gyrus, and superior frontal gyrus. So this basically brings clarity to the field where there were some inconsistencies with prior meta-analyses. Now, our first supplementary analysis took a look at two different types of autobiographical memory retrieval tasks, and we ran SDM meta-analyses on those subsets. So the first we identified was rehearsed AM tasks. So we found 15 papers where the cues that were presented in the scanner were created by using an autobiographical interview at most 1 week before the scan. And then 13 papers that used a spontaneous AM task, which is where novel cues were presented in the scanner. So here you can see the overlapping activation. The red activation is from the rehearsed AM task. The blue activation is from the spontaneous AM task, and the green is where they overlap. At first look, there may not seem to be a lot of overlapping activation. However, well, specifically in the medial temporal lobe, but when using a more lenient threshold, we did find bilateral medial temporal lobe activation in the spontaneous AM task condition as well. And so overall, much of the activation was overlapping across these two tasks, except for, interestingly, this left superior frontal gyrus activation in the spontaneous AM task, which makes a lot of sense considering the lateral PFC is generally linked to memory search and difficult cognitive tasks, which is definitely required in a spontaneous AM retrieval. Our second supplementary analysis wanted to assess the consistency of AM retrieval activations across the use of different control tasks. So we identified 3 common control tasks that were used and looked at the differences or the overlapping activation of AM retrieval when using these 3 different control tasks. So the control tasks were visual attention, such as reading pseudowords, semantic, such as reading, conducting word association judgments, and imagery, such as using theory of mind as the control task. And we identified these areas as overlapping across all 3 tasks, and these areas are very common to the AM retrieval network, including the frontal, parietal lobes, as well as the left middle temporal gyrus. These areas are also consistently activated in the default mode network. Okay, so in conclusion, this meta-analysis of autobiographical memory retrieval utilizes the most advanced statistical method and the largest set of AM studies to date. This meta-analysis brings clarity to the inconsistencies identified by previous meta-analyses. We also conducted 2 additional analyses, the first looking at 2 separate AM retrieval tasks. And this is the first meta-analysis to show that there are very few differences in neural activation between rehearsed and spontaneous AM tasks. And finally, by analyzing the overlapping areas of activation between 3 different types of control tasks, we identified the neural correlates of the most consistently activated regions during AM retrieval. And that is it. Thank you so much for coming to my poster virtually. And if you have any questions, I will be here through the question asking portal. And also, if you have any additional questions, please feel free to email me. My email address is at the bottom left-hand corner of this poster. It is swshepa@emory.edu. Thank you so much. Bye.